Hi everybody, I am Dr. Manu Mengi from the Bridget Clinic, Sector 80 Mohali. Today we are going to talk about plantar fasciitis. This is the second part of the video. Last part we had talked about the signs and symptoms and what exactly is the plantar fasciitis. If you have not seen that video, I am putting the link in the description below. Today we are going to talk about the diagnosis, the treatment and the prevention of plantar fasciitis. Coming to diagnosis. Diagnosis of plantar fasciitis is clinical examination and clinical history. Whenever the patient comes to me, I examine the patient. A specific point beneath the heel gives me the diagnosis for plantar fasciitis, or a specific point over the arch of the feet gives me the diagnosis of plantar fasciitis. Then the clinical history, patient complains. First few steps in the morning are the most painful steps, and if he or she continues walking, the pains either subsides or disappears completely. This is plantar fasciitis. I usually don't get any investigation done because plantar fasciitis is a clinical diagnosis. Now, whenever I get the investigations done, the blood investigations are done to rule out certain metabolic problems which may lead to plantar fasciitis. X-rays are done to rule out any other reason, any other condition, or sometimes even fractures also give the subtle fractures also mimic plantar fasciitis. That's why the X-rays are done. MRI and ultrasonography are reserved for those patients which do not respond to any kind of treatment. Only the refractory patients, I ask them for MRI or ultrasonography. Now coming to the treatment part of it, I ask my patient. Now these tips are this treatment which I am going to talk about today. I tell my patients in my private practice. I ask the patient to do contrast bath. Take a bucket full of hot water and cold water. Dip your feet in cold. First the hot water, then the cold, then the hot, then cold, then hot. This is known as contrast bath. Do contrast bath 3 times in a day. Apply gel. I advise some medications which are usually anti-inflammatory analgesics. But the mainstay of this treatment is physiotherapy, in which I ask my patient to get the physiotherapy done, and the physiotherapist with me takes care of that patient. Sometimes I also ask the patient to wear night splints. This is orthotic aid. Stretching needs to be done under supervision of physiotherapist. This is the treatment part of it. Now coming to the prevention. Don't walk bare feet. If you have to walk bare feet, walk either on grass or on sand. If you have to walk on the hard surface, please wear soft footwear. The footwear whose sole is thick and soft is to be worn. That is the kind of footwear that needs to be worn when you are walking. This will take care of the prevention. This will not allow plantar fasciitis to occur, and if there is plantar fasciitis, it will either stop it and will start reversing it. Till next time I will talk about something else in the next video. Till next time, stay healthy, stay active. Signing off, Dr. Manu Mengi, the Bridget Clinic, Mohali. Thank you so much.